We have to look at our investment policies, how we invest in building healthy communities. We have to look at our zoning policies. One unique example is looking at race-based zoning, the history of the racialization of spaces. The first city in this country that actually used race and racism in zoning was Baltimore.
Yes.
So you look at the historic, so look at why Baltimore looks the way it looks today. You have some communities that have resources, some communities that have a lot of vacant lots, vacant houses, more lead-based paint, closer to industrial hazards, legacy sites, and food deserts and food swamps. That's not by accident. So it's really about how we invest in people. And so if we invest in people and communities, so let's look at our zoning policies. Let's look at our planning policies. Let's look at Baltimore is actually doing a good job in trying to address food insecurity. So you have mobile markets, you have the urban agriculture. There's a lot of work being done to try to agent in place and how seniors having access to food. So there's some opportunities around food where we can modify context. So Baltimore is a good model for that. And then you look at our sustainability policies. How can you make a community sustainable if you're not investing in them economically and socially? So we have these sustainability initiatives in D.C. and Baltimore and across the country where that's something that we could look at too and say, where are the places where people have higher rates of obesity? Where are the places where people have higher rates of diabetes? Where are people where they're more food insecure? Where they have limited access to mass transit? So transportation equity impacts your access to healthy foods. Transportation equity impacts your access to physical opportunity. Can you get to the park? Other policies impact whether or not you have pedestrian-friendly infrastructure. Do you have crosswalks? Do you have sidewalks? Do you have proper signage? Do you have the bridge? Do you have lights? Just the basic components that make a neighborhood healthy, as I said earlier, that can impact the health of populations.